I'm Dr. Nancy Barnett of Columbia Pike Animal Hospital and Emergency Center, Town and Country Animal Hospital, and Animal Clinic of Clifton. And today we are going to have a conversation about everything you need to know about senior dog care. So there is a little bit of controversy over exactly what age your dog becomes a senior, and it probably is related to their size. Some dogs have a longer lifespan than others, but I think a general rule is any dog over 7, and we try to kind of, make it uniform for everybody, but every dog over 7 is considered a senior dog. So it is a very commonly asked question, and again, it really does depend on the size of dog that you have. Unfortunately, for those gorgeous giant breeds, they do have a shorter lifespan, and so we think 8 to 10 years for a giant breed. For a medium dog, their lifespan is probably to at least about 13 healthy years. For these little tiny guys like my number 1 assistant here, Georgie, they tend to have a longer lifespan, and so he could very easily go till 15. So one of the most common health issues in senior dogs is mobility issues. They can be very, very hard for you to recognize at home, but if your dog used to jump up on the couch, not that we recommend that, but if your dog used to jump up in your car or go up the stairs very quickly and seems to hesitate now and isn't able to go places like they used to, and or on your walks you notice that they're slowing down or even stopping sometimes to tell you that they don't want to go any further, those are very, very good indicators that there's some degree of pain going on. Also, if your dog happens to be limping, dogs would never limp if they didn't have to, so lame equals pain. So if a dog is limping, it means that they're painful. Even if they're not complaining or whining or telling you that they're painful, they are. So senior dogs really need to see us more than once a year, so we recommend that they come in twice a year. Often by the time that they're seniors, they're on some medication that actually requires that they come in twice a year, but it also helps us to intervene and do some things proactively for them if we get to see them twice a year. The dog food world is very, very, very good about letting you know that there are diets that are appropriate for different age categories. So you should have your dog over 7 on a senior diet. It should be labeled for seniors. There are some diets that say all life stages. Me personally, I prefer the ones that separate out the life stages, but the ones that are for seniors are appropriate for anybody over 7. One of the things in the senior wellness plans that are very important is that they do have multiple visits for you. So that does facilitate you coming in twice a year. They also have very good, robust blood work in the wellness plan. So you should do some type of screening blood work on your pet twice a year. So one of the signs and very common thing that happens in senior dogs is that they do have some cognitive changes that you should be mindful of, mostly to make it safe for them. So as they age, they do lose things like their vision, mostly their near vision, not their distance vision, but that makes it a little difficult for them to navigate places. So you have to be careful about that, particularly in the dark. The other thing is they lose their hearing, and those things combined with a little bit of cognitive change can make it really hard for them to navigate through your house, can make it hard for them to get outside, to do their potty breaks. And a common thing we get phone calls about is, oh my gosh, I found my dog in the corner, that they wander into a corner when they're attempting to make it outside to go to the bathroom, and then of course they'll have an accident in the house. Believe me, once dogs are well house trained, it hurts them more than it hurts us when they have an accident in the house. And so it's very, very upsetting to them. So you do have to change around some things with them for sure. Other things that sort of happen when their cognition changes is they may change their appetite, meaning not that they're not hungry, but they may be hungry at different times of day. They may get their days and nights a little mixed up. They may even vocalize at night, which is a really odd thing, but we think it's related to not only the cognitive change, but their hearing change. And so those are all pretty common senior cognition changes. Both of those things are really lovely. So active for sure, that you do need to encourage them, make sure that they have comfortable but low, slow exercise. So it is good for them to go on long walks with you, not too long, but a walk enough, because they do things when they're out on a walk that they don't do when you just let them into your backyard sometimes. So they'll see other pets, they'll see birds, they'll see all sorts of things that they have to actually register, think about, look at, navigate. So those are all very good things. There are some very good enrichment toys now too for senior dogs that you can do in the house with them. And as far as interaction with other dogs, I'm not really a big fan of introducing them to new dogs in their senior life, just because it may not be well received, and it can be hard for them to get out of the way if they need to. But those are very good things. There are also some very nice supplements for them that have antioxidants. There are some food now, foods that have additives in them that are particularly for senior dogs. All of those are great things to do for your senior. So Georgie can speak to this very well. So Georgie came to us as a senior, and Georgie only has 2 teeth left in his head and a lot of bone loss in his jaw, which you may see his little tongue hanging out and his little lip hanging, because he did not receive good dental care. So dental care should start actually in adulthood and really improve. The fact that they have tartar may allow you to keep their teeth in their head a lot longer, which is really important. It's always very important for how well they're able to eat, and dental care with them, earlier the better. So if you get them used to brushing their teeth and get them used to doing dental treats, any kind of food or water additive that helps with dental disease is all really, really important. And in seniors, that twice-a-year evaluation, because you'd be surprised how just one uncomfortable tooth in their head can make it hard for them to eat. And so if you see your senior who is on a dry food, cocking their head in a funny way, or dropping their food where they didn't used to drop their food, it may mean that they have a problem tooth in there that needs to be evaluated. So good reason to come twice a year. I mentioned earlier about if they're limping, so that's a really important thing. So lame equals pain. The other thing is stiffness, or even a little groan. In the larger dogs, you may notice when they settle, so they'll do a little spin, spin, spin move and then try to lay down. When they go down, you may hear them do this little grunt or groan. That's probably because they're uncomfortable. So that's important to mention that to your veterinarian. As I said, limping is lameness is pain, so that needs to be mentioned to your veterinarian as well. Some dogs have behavioral changes when they're uncomfortable, particularly around family members. So maybe even the little people in your life. So if they go to pat their back end or do something that's uncomfortable, you may notice a dog would react that didn't used to react. Those are all really important things to talk to your veterinarian about. Thank you so much for watching this video. I think I must have bored poor Georgie here because he fell asleep while we're doing this, which is a good thing. That means Georgie's comfortable at the veterinarian's office. But if we can ever be of any help with anything, any questions that you have about your senior dog care, please don't hesitate to reach out to us. Thanks so much.